Mehmet Oz is somebody I am privileged to call a friend. I hope he feels the same way. His career is extraordinary. This man was the head of the Department of Cardiothoracic Surgery at Columbia Presbyterian Hospital. This is a very, very stratospheric position. But that's not enough. He had to go do a daytime talk show and 13 successful seasons on daytime talk. Still, that wasn't enough. Then he had to run for senator in Pennsylvania. And now he's the administrator for the Centers for Medicare and Medicaid. He joins us today, Mehmet Oz. Dr. Oz, thank you so much for being here.
Well, Drew, I do consider you a friend. Thanks for that kind introduction. And I should highlight, since you went through my pedigree, yours is, of course, impeccable as well, but this is the best job I've ever had. Being able to work with folks who are absolutely dedicated, mission-aligned, making America healthy, but at the same time, they know so much about the health economics of this country and what we need to do to make it better and more effective in getting America to be its best is, to me, I get goosebumps.
Well, I get goosebumps and my heart sort of swells hearing you say that, because you don't say stuff, you're not prone to hyperbole. You know what I mean? You really mean it when you say that. And one of the things I wanted to ask you was, how does this look to you? You know, you were outside and now you're inside. How does it look?
When you're on the inside, you see all kinds of opportunities, because you can't be a wealthy nation if you're not a healthy nation. So much of what we do is driven by numbers, but it's what those numbers reflect. And I think President Trump needs to get a lot of credit for this. He and Secretary Kennedy changed the narrative. They realized, for example, we have the power to convene. We don't have to do it all ourselves. You don't have to always pass a law or a rule or regulation. Sometimes you just say to industry, guys, come on. We know you went into the business because you cared about people, in theory anyway, because your business has to do with health. So let's go back to those roots. Let's put people above profits. Let's figure out what can we do differently. Let me just give you a couple examples. Ideally, you remind people that this process used to have a good purpose. We've morphed it into something that's unrecognizably difficult for Americans to understand. Let's go back to the reasons it might work. What do you got to do to clean it up, to make it instantaneous, so you don't hold up people from getting their care, but you prevent care that's not necessary or inappropriate? You and I, as clinicians, know that the patients own their medical records, but unfortunately, despite the fact you own those records, you cannot get your hands on them most of the time. So we got 60 of the biggest companies, every technology company you ever heard of pretty much, that touches healthcare came to the White House 2 weeks ago. We had a big summit. The president hosted it. We've come to a place in America where we just aren't fit anymore. So using technology to connect people to their own medical records allows us to message to you and say, hey, listen, you know, since you let me do this, and security is top priority here, we've noticed a few things you ought to be doing, like take a walk. And here's how you might do a walk better. Here's the kind of music you might enjoy. And so all of a sudden, you start to engage people in ways historically Medicare was silent on.
And you have an email thread now going out encouraging people to stay healthy. Tell me about that.
22 million people get an email from me asking them to do things that you and I would advise our relatives and friends to do. Every American did 15 minutes of walking a day, probably save us $100 billion. $100 billion, Drew. Think about that. If we can get the average American to feel stronger, vital, better, and let them flourish more in life, maybe they'd work a few extra years. Think about this. If the average person born in 64 would work until age 64 instead of retiring this year, it's worth $1 trillion to the U.S. economy. $1 trillion. That would take care of half our increased debt. The taxes on that would make sure that we keep Medicare and Medicaid, the programs that I'm charged with managing, solvent. All of a sudden, the problems get a lot smaller because people are productive in American society. So again, it's not about giving people an insurance card. We do that too. But with that insurance card should come incentives to do the right thing for yourself, both patients and doctors.
Yep, I totally agree with you. And I know you and I have worked out essentially our whole life, but I've not made an issue of it to patients. And I'm embarrassed by that. And particularly things like resistance training, you know, sarcopenia, losing muscle mass, is the enemy of aging. And we can do something with the very advanced age too by maintaining their muscle mass and balance.
The other thing, of course, that we don't pay attention to enough is the medical benefits of the foods that we eat. And unfortunately, if we don't pay for the right foods, we'll pay for the medications that treat the problem. But you can't just sprinkle a little bit of a statin drug on a kielbasa and make it acceptable. You really do have to make the fundamentally right choice about what you're eating and then layer on top of that the advice you might get from your doctor.
I don't think I'm going to soon strike from my memory banks the image of a statin kielbasa. But one of the rhetorical sort of phrases I kept hearing all the way through my career. We got to support primary care. We got to support primary care. Better for primary care. And yet I practiced primary care most of my career, and we were squeezed down worse and worse and worse and worse. Now to the point where no physicians are going into primary care. It's just a terrible way. You pay a price for going into primary care. Any plans to help the primary caretakers?
We have plans. We're also already embarked on these plans. We are changing in the physician pay systems, the amount of money that primary care doctors are getting. We have a $50 billion rural transformation fund that's going to go to helping rural communities increase their manpower supply, amongst other things. But we also have to think differently about the challenges of being a primary care doctor. As you know, since you practiced it, primary care doctors are the real doctors. They're the ones in the front line dealing with all coming problems. A lot of times it's emotional issues, which you have expertise in, but a lot of primary care doctors are challenged by these issues. Patients desperately need a coach in their corner, and primary care medicine is that. So we want to allow primary care doctors to see more people without burning themselves out. Technology might help. Some of the agentic AI, the avatars that we're seeing right now are incredibly sophisticated. Now, no one's going to replace a human being, look at you in the eyes and saying, I'm here for you. But an AI tool could make it easier for a primary care doctor to get all the information collected ahead of time, provide some of the basics of what's going to happen, and then the doctor can step in at the most critical moment. Instead of spending a full hour, spend maybe 20 minutes getting most of the squeeze out of the interview. That sacred time you have with your doctor should not be spent digging through your purse trying to find what medications you're on. So we want to help make that easier. Part of the reason we had that information technology summit at the White House 2 weeks ago that I alluded to is because the beneficiaries can now rest assured, if their data is secure and safe, that their doctor might actually use that information tool technology to interact with them. So after you finish with the visit with the primary care doctor, which is now much more fulfilling because you had a very clear game plan going into it, you were able to take care of a lot of the paperwork stuff without having to waste your time and the doctor's time. Now, all of a sudden, you go home and there's a very clear plan. That's how we'll make primary care great again in America. That's how we'll get it to thrive as it always was. By the way, I just joined Medicare. I turned 65. Congrats. So, but those of us who remember Marcus Welby, he was a primary care doctor, right? He was a family practice doctor. He could do a lot of stuff in his office, and you trusted him because he understood enough about what was happening in the world of health. He could be a real advisor to you. Before you get sent off to 15 different specialists, you had someone that was actually going to be your coach in your corner all the time.
So I'm very concerned about any one-size-fits-all vaccine, surgery, you name it. We need to be able to tell patients the risk rewards. Here are the outcomes. Here's the evidence. And if there's not good evidence, we shouldn't be recommending it. That's our do no harm is our credo.
Drew, beautifully stated. And maybe I could give you just as one bit of advice at the end for the folks who are watching who wonder, what is the MAHA movement really about? Because it speaks to what you just said. To me, one word defines MAHA: curiosity, but truly curious. And remember, most questions are actually statements in disguise. To truly be curious, to really want to know the answer, and when you get the answer, to courageously and compassionately share it with others takes a lot of effort. That's what the MAHA movement's been about. It's embodied by Bobby Kennedy, but there's many moms out there who don't understand why it's gotten so hard to keep their families healthy, who are curious, they're compassionate, obviously, they're moms, and they're courageous enough to speak about this. And this is a bipartisan issue that appropriately is getting attention. There's been almost a 50% uptick in state governments, red and blue states, pushing for MAHA bills to clean up the place, make it easier for us to raise families that are healthy, because it's manifesting in all kinds of ways. We don't have to litigate that, but I think we can all agree America needs to be healthier. And by getting healthier, we'll be able to afford the health care that many of us ask for, deserve, and demand.
I am just so grateful and so thrilled you were in there, and I almost don't have words. So except to say thank you, not just for joining us today, but thank you for the hard work I know you're doing in there. And please call on me, sir, if you need anything. I'm at your service.
Well, for the addiction stuff in particular, but across the board, it'd be great to have you inside rowing. Retire from that dead-end job of yours and come work with us.
All right, my friend. Talk to you soon.
Take care. Bye-bye.
So exciting. All right, we have some great stories coming up, so stick with us. We'll be right back.